Nearly 6,000 people are here in Orlando for the 24th annual IHI National Forum. Hello, I'm Kendra Farn for IHI TV. On Tuesday morning, crowds poured into the Cypress Ballroom for a keynote speech from IHI CEO Maureen Bisignano. Maureen's speech set the tone for the first day of the General Conference. Right off the bat, she highlighted the challenges the healthcare industry will face as a result of the Affordable Care Act.
How do we implement the Affordable Care Act, which is going to mean bringing millions of people now into the healthcare system in a helpful and partnered way? Tremendous financial pressures, I think, and we're seeing that all around the world. I think we've got to move our models from a model that was primarily based on fee-for-service to really thinking about care across the continuum. And we've got to cut costs while we're improving quality.
Coming up later in our show, we'll talk one-on-one with Maureen about those challenges and about her recent visit with the Dalai Lama. In just about a year from now, all states will have health exchanges established where people can shop for insurance. These exchanges will either be run by the state or the federal government. Wisconsin is one of 20 states that has told Washington it will not run a state exchange. On Tuesday morning, healthcare leaders from Wisconsin shared their story with attendees, and IHI TV's Ed Highland was there.
They lead the top healthcare organizations in Wisconsin and will be on the front line of the AHA Challenge. But they are already responsible for tens of thousands of patient interactions and set the bar for attendees at this special interest keynote.
How do we as healthcare organizations provide value, not just to the patients, which historically we've always done, but the greater community?
The panel of experts admit they have questions too as the transition takes place, not just delivering care, but the challenge of moving to a value-based payment model.
There's still a lot of organizations, physicians, independent labs and radiology services and hospitals that are pretty much making their living on fee-for-service and moving through people pretty quickly rather than saying, how do we keep them the most healthy?
And having all the members of the exchange buy into the concept.
Yeah, you can integrate all you want, but unless you have the right outcomes for patients, I mean, that's where the rubber hits the road, is what you're actually doing for the patient population, not just combining systems.
These CEOs will, in many ways, be competing against each other for patients under the ACA. Success may be determined by how well they manage their own resources.
Do they have really a shared concept of what's needed and what will be driving the organization going forward? To me, that's the most crucial issue.
For IHI TV, I'm Ed Highland.
2 days after President Obama was reelected, IHI hosted a gathering in Washington called Out of the Blocks. In a room overlooking the Capitol building, more than 100 healthcare leaders met with political experts. The goal? To analyze and understand the election and its implications for the Affordable Care Act. Former IHI President and CEO Donald Berwick was at that meeting and says it was a call to action for the industry.
The door is wide open for people who give care to really figure out how to reconfigure that care to achieve the triple aim: better care, better health, and lower cost for everyone through improvement.
Berwick says the group outlined a need for transparency and recognized that with President Obama's re-election, the challenge of healthcare reform has shifted from the political arena to healthcare providers. More than 200 CEOs and members of their executive leadership teams gathered at the 15th Annual CEO and Leadership Summit. During this program, healthcare professionals shared strategies and successes for establishing changes in culture within their individual organization. Jim Reinertsen led the discussion.
The CEO Summit has traditionally been a little group that gets together and shares their toughest challenges and say, can anybody help me? And so today we have on offer some responses to what we think those challenges are, but who knows? A lot of different things happen that aren't planned in the CEO Summit. That's why it's such a fun meeting to do.
Throughout the session, attendees worked in groups to address those challenges, and then as a whole, the entire room came up with solutions. The Picker Institute is world-renowned for advancing the principles of patient-centered care. Its branch in the U.S. is closing, but its work will go on. A reception brought together the Picker board for a last group photo and a chance to mingle with supporters. The guiding principle of Picker will be carried forward by its legacy partners in the U.S., including IHI.
IHI has the sustainability opportunity to nourish and nurture the important work of having things always happen on behalf of people who are receiving care is such a nice, natural fit.
Treating me kindly, considerately, looking after me well, making sure that I'm the focus from the moment I enter the system till the moment I leave it. I'm very proud of that legacy.
Picker's 8 principles of patient-centered care are commonly recognized across all healthcare systems. Education workshops continued throughout the day, highlighting a number of unique topics. At this session, attendees were introduced to the 3 new elements of the enhanced surgical bundle used to reduce surgical site infections following hip and knee replacement surgery. Tony DeGioia led the session and says SSIs have a huge effect both on the outcome of the patient and the associated costs.
It is one of the most feared adverse events, both for doctors and the care team as well as for the patients. But it hasn't been put into a bundle that could be easily adopted and utilized. And that's the emphasis of the IHI Joints project, was to develop the bundle, but then also to push it out, and how to push out best practices as widely as possible so that more and more patients can see the benefits of the intervention.
And coming up on IHI TV, National Forum co-chair Alita Chase joins us for a conversation about quality and safety. Plus, big posters that tell amazing stories. It's the storyboard reception, and we'll take you there. Also ahead, open school students from across the country gather to compare notes and share stories. You're watching IHI TV.
In 2010, Cincinnati Children's Hospital Medical Center established the Community and Population Health Initiative as part of its strategic plan. It's a partnership between the hospital, community, and civic organizations in Hamilton County.
Community and population health is a strategic priority for us because we are really all about improving health for children.
The Cincinnati Children's Infant Mortality Team works to reduce preterm birth and improve infant outcomes. The obesity team is working to make progress in the field of childhood nutrition. By starting small in 3 targeted neighborhoods, Cincinnati Children's is developing prototypes for improving population health on a larger scale.
If we're able to move the dial and we can visibly show healthier communities, I think it's applicable anywhere.
You're watching IHI TV.
Reducing central line infections is among Blessing Hospital's most successful initiatives to improve patient safety. Blessing is a regional leader in patient and family-centered care, and as the largest hospital in Western Illinois, serves patients in 3 states. Recently, the hospital implemented IHI's Central Line Bundle and then incorporated their checklist into each patient's electronic medical record.
We shared results, and I think that's very important. We had a long run of months with 0 that was celebrated in the organization.
We had a Sweet 16 party when we reached a 16-month period with no central line infections.
My favorite thing is to see the graphs going in the right direction.
And I look at all of the learning that has gone on and the science behind it and what we're able to do for patients today, and I find it exciting.
The 5th Annual Open School Chapter Congress was held Monday night at the Gaylord Palms Resort. Students from all over the country came together for 3 full hours of networking and comparing notes about their chapters. Since quality and safety are not typically offered in their regular curriculum, face-to-face meetings with other students to brainstorm about their open school experience is important.
It sort of brings a lot of the leaders that we have out there, people that are really extension of IHI, to come together and hear the same message, share best practices, share the obstacles and the successes that they've had in the past year.
I also thought that Don Berwick's speech, I mean, he's always a great speaker, but he really knows how to pull at the heartstrings. He said a lot of great things, that very motivational, and I think specifically his idea that we're the youth, we can make a lot of change. We do have a lot of power, which we don't always think most of the time. So it's just cool to hear someone of his stature say how much he believes in everything that we're doing.
Today's open school students are tomorrow's healthcare leaders, so building a network of contacts and expanding the chapters are critical. Learning, connecting, reconnecting, and sharing. That's what IHI CEO Maureen Bisignano says this year's National Forum is all about. 24th year. What's the buzz?
Oh, it's great. It's so exciting to see all these people here. And the energy is really around, I think it's around spread. It's around learning from each other. And what I'm seeing is kind of a global learning network emerge where solutions are moving from one country to another, from one system to another, and it's really exciting.
You talk actually about, in your speech, successes in other countries, Scotland and Ghana. How do you actually see those successes replicated, framework shared? How do you see that happening?
Well, I think that's IHI's job. I see our role as helping organizations or countries to make these kind of improvements, and then bringing those ideas back. An example would be from Ghana or Malawi. We're finding that if you work on maternal or neonatal health problems and you're just in the hospital, that you're only seeing one slice of the pie. But here we've developed a model that looks at care across the whole continuum and creates partnerships with people in the tribal communities, people before and after the hospitalizations. I think in the US we can actually learn those lessons.
You talk in your speech this morning about the transition from fee-for-service to value-based care and really redesigning systems, cutting costs, while at the same time improving the outcome. How do you see that possible? You say it's possible.
It's definitely possible. Right now, we've got a system that's so fragmented. My colleague Susan Edgman-Levitan calls it "what's the matter" medicine. And I think what happens is now a patient will come into a hospital or to a physician practice, and our question is, what's the matter? And then we deal with that symptom. We deal with a high hemoglobin, or we deal with a need for a surgical procedure. When we move from what's the matter medicine to what matters to you, what we're seeing is that there's lots of waste in the system that's right now accumulating there because of fragmentation. When we work with the patient over time, when the patient perhaps owns their record and they are in control of their lab results, we're seeing less duplication. We're seeing patients take their medication in a different way. We're seeing fewer procedures when they really understand the implications of that.
And IHI has always driven home in this sort of collaborative effort to never leave the patient out. You've always been big as an organization on the patient matters, their opinions matter.
My favorite thing here at the forum this year is the booth that says the patient is in. And I love that, that they began to think about the old system was the doctor is in. And now the patient is in. And people are stopping by the booth and they're asking for advice and they're talking to patients to get their expertise on what's the right way to redesign healthcare.
A lot of milestones, one of which was the passage of the Affordable Care Act. A hot topic, clearly, but has that changed the tone, do you think, a little bit?
Oh, I think it's changed the tone a lot. We held a meeting in Washington on November 8th, 2 days after the election, and we had over 100 people there, policymakers, politicians, hospital leaders, ACO leaders, physicians. And the question was, on the one hand, what's the same, and on the other hand, what's very, very different. On the what's the same people the same people are in their jobs in Washington, the same issues are on the table. But what's different is the Affordable Care Act will be implemented, and that creates a sense of certainty that we've got to transform the healthcare system in the United States.
I can't let you go without asking you about meeting the Dalai Lama.
I had a wonderful experience. I had an hour with the Dalai Lama, and it was a transformative experience that I will treasure always. And he helped me to see the challenges that we all face in healthcare in a very different way. In a way, he embodies the IHI adage of when you come upon a wall, throw your hat over it, and then go get your hat. Because as we spoke to him about a number of challenges, healthcare, politics, other challenges in education, he said he had a way for us to think about compassion and resilience as tools that will help us to solve any problem. And I came away with such an incredible sense of hope and optimism.
Incredible. Thank you, Maureen. I know you're on a tight schedule. Thanks.
Thank you.
Up next on IHI TV, we'll go inside the exhibition hall where hundreds of healthcare organizations and related vendors are on hand to share news and product information. And big stories of success on big poster boards. It's the storyboard reception, and we'll hear from some of the participants.
10 years ago, Children's Healthcare of Atlanta began a journey to eliminate infections at its 3 campuses.
What we try to focus on is preventing hospital-acquired or hospital-associated bloodstream infections.
The most recent campaign that we've adopted is called One is Not Zero, where one defect, one degree of variation, one error, one injured patient, etc., is not zero. And our goal is perfection.
Infection control is working system-wide.
Our bloodstream infection rate for 2010 was 1.8. In 2011, it was 0.7. We went over 190 days with no bloodstream infection, and that's the longest period of time we have gone without a bloodstream infection.
One of the big reasons why our improvement efforts around BSI has been so successful is because it is an absolute partnership between the quality department and our operational colleagues.
You're watching IHI TV.
Since its inception in the late 1980s, the Picker Institute has built on the concept that patients must be at the center of the healthcare picture. Led by its original team of researchers, the Picker Institute helped introduce the first scientifically validated patient experience surveys. With the 1993 publication of Through the Patient's Eyes, the Institute demonstrated how a patient-centered focus would improve the quality of care.
That was the beginning of what became and what is patient-centered care.
The Picker Institute's mission to improve the patient experience took an even greater step forward in 2009 with the advent of Always events. In 2013, the Picker Institute will close its doors, handing off its programs to a stellar array of healthcare organizations.
We will always attribute this work of Always Events, Always Experience, and patient family-centered care for that matter, to the original work of Harvey Picker and to the contemporary work of the Institute.
The National Forum Exhibition Hall is always a center of activity and enthusiasm during the conference. This year, there are more than 145 exhibitors displaying the latest products and services in the healthcare industry. Attendees are also able to interact and network with hundreds of healthcare professionals while learning about the companies on display. And if you missed your chance to stop by earlier this week, the exhibit hall will be open Wednesday afternoon from 10:45 a.m. to 2 p.m. We are joined by Alita Chase. She is a Senior VP at Kaiser Permanente. Thanks for joining us. I want to start with one of the big things on your plate, which is Medicare operations. Daunting, I'm sure, but tell me where you are with that.
We've been working diligently the last several years on deep thinking around the area of care of our Medicare population. In particular, care of elders. We started the work by focusing in on what practices and programs do we already know and we do well, and we need to execute on them reliably across our whole organization. And probably one that you'd be familiar with, and as a matter of fact, there's some teaching right now going on at IHI, is about having solid palliative care services available in all settings across our delivery system, and increasing the number of participants in palliative care programs. So that would be an example. Mm-hmm. Another one is to have safe transitions from hospital to home, avoiding harm, having our patients feel like they have the information they need, and finally avoiding hospital readmissions. So when I think about that initial body of work, it's, well, what are we doing now we already have those packages or programs, and we need to reliably execute across the organization.
Right.
Second is reducing variation. So we've been spending quite a bit of time understanding variation, where we have variation. Probably a wonderful example is to increase our opportunities for our patients to have shared decision making. And then the final area, and really the most exciting, is care transformation for this population. Now, this is over on the innovation space. What kinds of models of care are going to emerge in the new environment where care will be delivered outside of traditional settings? So what care is happening in hospitals today that might happen in an ambulatory clinic? What care is happening in an ambulatory clinic or a brick and mortar that might happen virtually,
right,
or in the home or in the community?
Right. Another area, obviously, that Kaiser is very establishing is the integrated delivery system. Do you find here at the forum that's a success that a lot of people want to talk to you about?
Absolutely. So, Kaiser is a 50-plus year history organization, and there's no question in our mind that our integration of our primary care, our specialty care, our unique relationship with our medical group is a differentiator for us. Mm-hmm. That, coupled with the fact that we're now the largest civilian deployment of an electronic medical record, and we finished that execution, has just been this powerful combination in thrusting our organization forward. And I've met so many people here at the forum who are both, some moving towards integrated systems, mm-hmm, hospitals and primary care units moving towards becoming ACOs and wanting to understand and have pearls from Kaiser about, our history, but also people who are still in the middle of executing on their medical record, their electronic medical record. That's quite a journey for any healthcare system. We've been at it quite a while, and we're past the struggle with execution and well on our way into the leveraging of that very powerful tool to support the work of our staff and our patients and our members.
And the forum is all about spreading the word of successes, as we know.
Absolutely. Yep.
You are, speaking of the forum, one of the co-chairs,
yep,
and one of the things that you've said to me is that the forum really, you feel, one of the initial goals is just to really build will. Tell me about that.
I share every year that I come to the forum, and I know it's going to be exciting. I know that intellectually, but when I get here, it's like an explosion of ideas. Maureen's talk this morning was the great push forward for me. And I was sitting in the audience thinking, in my job, with what I'm leading, how can I go even farther, push and work with the people that I work with, particularly in the area of patient-centered care, member voice, patient activation. We're in that space, but it just inspired me to go even farther.
Great. That's what it's about. Alita, thanks so much for joining me. That was great.
Thanks.
Every year, select healthcare organizations from across the world illustrate their quality improvement success stories on giant poster boards and share them with all forum attendees. It's a dynamic gathering, and we sent IHI TV's Ed Highland to check it out.
It's said that every picture tells a story, but here it's storyboards, and what they're telling us is about a service, a product, or some other way to improve healthcare.
Okay, I'm Tim Tyner from Blanchard Valley Health System in Findlay, Ohio. We've developed a value-based purchasing interactive performance modeler that allows facilities to identify loss or gain by each one of the individual measures, either the clinic.
And over 3 years with engaging our frontline staff and managers, we did a 54% reduction, which equated to about 1,790 C. diff cases being prevented.
Storyboards are an integral part of IHI's conferences and events, providing an opportunity for organizations to share their improvement strategies and celebrate their successes.
X-ray has been the redheaded stepchild in healthcare, so our focus was trying to improve that. We were able to get about 74% improvement without adding any cost.
And we are part of a process improvement team that works with the end user nurses to look at their processes, and ideally what they're doing is removing the waste out of the process and adding value, which ultimately improves the patient experience.
Now multiply what you've heard and you get over 550 storyboard presentations. For IHI TV, I'm Ed Highland.
And still to come on this edition of IHI TV, how to solve the problem of hospital readmissions. We'll talk in depth with IHI's Patricia Rutherford. Stay with us.
Saskatchewan, the land of the living skies, is the 7th largest of Canada's 13 provinces. Today, Saskatchewan is the first province in Canada to use a lean system of continuous improvement to achieve better care, better health, better teams, and better value for the citizens of Saskatchewan.
The goal is that every provider understands and knows what they contribute to this, and that every patient will know that it's all about them.
Thanks to a number of specific initiatives, such as the Saskatchewan Surgical Initiative, patients are already seeing better care.
Only once or twice in a lifetime, in a career, that you get to do a big change.
Saskatchewan is literally changing how patients access their care and paying off on the promises of better health and better value. Better teams means doctors, nurses, patients, and administrators all have a voice in how care is redesigned.
So yeah, the journey is a long one, but the size of the ambition is second to none, and that's what's so exciting about working here.
You're watching IHI TV.
Gunderson Lutheran is not just the largest health system in western Wisconsin. It is the largest employer in La Crosse County. Gunderson Lutheran has launched several initiatives, all of which tie into the IHI triple aim. The Care Coordination Program for patients with complex conditions is foundational to Gunderson's goal of transforming healthcare.
And it's a primary care provider is a hub with the nurse coordinators and social workers coordinating with multiple patients, families, and providers.
Fighting obesity is central to improving the health of the population. Gunderson has developed several nutrition and healthy eating programs to reduce obesity-related illness and keep healthcare costs down. Another way Gunderson is working to control costs is by controlling its energy consumption. They are on track to be 100% energy independent by 2014.
As a healthcare organization and as the largest employer, people pay attention when we lead.
We are joined by Pat Rutherford. She is a vice president here at IHI. Thanks for joining us. Sure. Let's start with a big passion of yours, preventing hospital readmissions. Why so critical?
Well, I think there's a lot of attention being paid to this problem because of the funding sources through CMS and some of the penalties that are now coming to bear on hospitals that have higher than average readmission rates, and that's really good, and I think it's catalyzed a lot of attention to a problem that's been ongoing in patients' and families' lives, and now it's getting attention, and I think is really important. Why I'm passionate about it is it really puts the patient into the center of the healthcare system, and I think we work in silos of care, and we're doing really great things in hospitals, we're doing great things in redesigning primary care and patient-centered medical homes and new and innovative work in skilled nursing facilities. But it's really hard for patients to navigate between sites of care and to really, they have to hold the coordination of care themselves. And I think that this project puts the patient and the family in the center. And we are working very, very hard to have collaboration amongst all the clinical entities and supports and community services to really build a better system of care and network to help patients and families deal with chronic illnesses in particular.
The STAR initiative has been successful, and where are we taking it?
We're learning a tremendous amount in the STAR initiative. The STAR initiative is funded by the Commonwealth Fund, and we're in the 4th year of that work, and we're working in 3 states, Massachusetts, Michigan, and Washington State, and actually we worked with Ohio also for a year. They provided their own funding to parallel the work that we were doing in the STAR initiative. And what we're learning there, I think one of the most important aspects is how individuals in the healthcare system are coming together in what we call a cross-continuum team. And in that includes clinicians and staff from hospitals, office practices, home health, skilled nursing facilities, agencies on aging. And they're working together to have better transitions between clinical settings and to provide a more patient-centric model of care and plan of care when they're going home or to a skilled nursing facility.
Another sort of focus back again to the
Yes.
patient that we don't hear a lot about, actually, is really transforming bedside care. Why is that so important?
Well, that's another project that I played a leadership role in, and that was funded by the Robert Wood Johnson Foundation. We work collaboratively with leaders there, Sue Hass-Miller and others, to look at medical and surgical units in hospitals. And that's an area within the hospital that always hasn't gotten as much attention as intensive care units and emergency rooms and safety platforms. So we felt that a great deal of care was going on in those units, and not a lot of new ways of doing work had really taken hold. So we worked to really redesign all of the work on the units, really empowering the frontline staff, nurses taking a predominant leadership role with other members of the team to really transform care. And first and foremost, we empowered nursing staff and other members of the team to know how to run PDSA cycles, as we say at IHI, and to really learn how to test their own ideas and test other ideas that have been proven elsewhere, adapting them to their own settings to really improve care, such as reducing pressure ulcers, reducing falls, reducing nursing turnover. And that's actually where our discharge preparations and the foundations for the STAR initiative in patient-centered care in helping patients and families go home with a better understanding of how to care for themselves.
It's all linked together, right? Comes
It's
full
all
circle.
kind of links together, yes.
Okay.
That was actually the formative part, was in TCAP.
Pat, thank you so much for joining us. This was great.
You're welcome.
Appreciate
Thank
it.
you.
That wraps up this edition of IHI TV at the Forum. Enjoy your Wednesday sessions and have a safe trip home.